How does Age UK feel about this now really chronic staff shortage in care homes?
Well, good evening. Well, we're really worried about it. It's one of the biggest problems facing social care because a lot of people who need social care need one-to-one intensive support. And if care homes or home care providers haven't got the staff to provide that, that's a real problem. And so I'm pleased about the decision that Sajid Javid's made, because the really big worry was that if he'd pressed ahead, that lots of people who are currently working in home care, that's the sort of care where people come to your own home, that quite a few of those would then have quit. And they've already got something like, one in eight of their jobs are vacant, and we really can't afford any more people to walk away. So I think it was the right decision, and the right decision for the NHS as well, who are also, of course, coping with really big staffing shortages.
Yeah, but when you hear the argument, Caroline, and it's been made repeatedly over the last 6 months or so, when you hear the argument that, the older members of our society are the ones most likely to have underlying medical conditions for obvious reasons, therefore they are the most vulnerable to this virus, the argument gets made that if staff have had the double jab and the booster, the argument is made that then makes the patients they're looking after safer. How do you respond to that argument?
Well, I actually agree with what Mr. Javid said in your clip. He was pointing out that the balance of risk has changed during the pandemic, and I think he's right. So now with the Omicron variant, we know, thankfully, it's less lethal for older people. So therefore, I think having a jab is less important now than it was earlier on in the pandemic, when undoubtedly, with all the risks of the earlier variants, it really was important for people to have jabs. And I'd like to say that at Age UK, we're very pro people having their jabs, and I've certainly had all of mine. We were never very pro the idea of trying to force people to do it, because we thought it wouldn't work. And, I think the facts have rather borne us out. I think more encouragement, a bit more carrot and a bit less stick would have been more sensible. But we are where we are.
Yeah, no, I can fully understand why you would encourage 90-year-olds to have the jab, but we were talking here, in terms of the vaccine mandate, about fit 22-year-old young men and young women who really were at very little risk from the virus. So will you join the call, Caroline Abrahams, will you join the call for the government to give some clarity to the care home sector and to allow these up to 40,000 people to go back to work?
Well, I think having clarity is absolutely crucial, because right now, care home providers like Jeremy, who you were talking to, aren't clear what the employment rights are of these people who left. Actually, do they have a legal right to return? So that's got to be clarified very, very quickly. I think the reality is a lot of those people will have gone off to other jobs. They'll have gone either to work in home care, where at that stage there wasn't a requirement to have the jab. And we know many people are leaving to go, when Amazon builds a warehouse, opens a new warehouse in an area, lots of care staff go and work there because it's better terms and conditions. That's part of the issue here. So I fear that an awful lot of these people have already gone into other jobs and won't particularly want to come back anyway. But, if they do want to come back, and if they've been good staff, completely understand Jeremy's point of view. We want as many good people as we can possibly get working in social care. It's so important for older people.
Thank you very much indeed, Caroline Abrahams from Age UK.